Okay, so welcome everyone to another episode of AI in Healthcare Envisioned and Reimagined. Today, I'd like to introduce you all to Mina Gamil. He is a board certified pharmacotherapy specialist. Mina has a wealth of knowledge in clinical drug management and evidence based practice. He spent the last 4.5 years optimizing treatment outcomes and navigating complex pharmacotherapy at American Hospital Dubai. Mina, we'd love to hear a little bit more about you.
Thank you, Andrew, so much. It's a great pleasure for me to be here. I'm incredibly excited about this conversation because actually we are not talking only about technology as a layer on top of medicine, but actually we are talking about rebuilding a foundational framework of patient care. And this is actually a much bigger and much more exciting conversation. So actually getting back about me, just a small hint. So my name is Mina Gamil. I'm actually a board certified pharmacist currently working at American Hospital Dubai for the past 4.5 years. I spent around 10 years of my career here in UAE, based in Dubai. I worked in many major healthcare organizations across Dubai and ended up in American Hospital Dubai. This is a small hint about me. Let's get started.
Thanks a lot, Mina, for that great introduction. To start off the conversation, we would like to understand a little bit more about you've spent your entire career solving complex healthcare puzzles. I mean, both of us, right? We've been in the forefront of health
Right, right,
technology,
right.
and the goal has always been to improve and better the patient outcomes. So, from your clinical journey leading a project focused on tracking medication use, how do you see AI can serve as a brain if it gets attached to the medical tracking system?
Oh, thanks, Andrew, for that perspective. So when we look at the medication tracking today, traditional systems, which everybody uses right now, act like an archive, if you can say. So we use it for documenting medication, for documenting the prescribing, the administration of the drug for each patient we have in the hospital or any healthcare system. So we use it mainly as an archive. We can see the patient medication history. We can see the disease history, the diagnostics history, also the lab results and finding. So if you can see from all of this, you can tell exactly that all of these information give you what happened after the drug was dispensed. You don't know that you don't know what exactly happened before it was dispensed. It's only an archive. You can consider it as a passive documentation of the patient history. So I would like to see the future of AI in healthcare not as a passive database, but as you mentioned, as a central nervous system. So if you are in the biological body, the nerves constantly send micro signals to the brain to adjust the balance before you fall. So by using that perspective, by feeding the tracking data into an AI powerhouse, so we shift from a reactive position to another position which is more powerful, which is a preventive and predictive model. So the biggest gap we can see, both of us right now today in healthcare, it lies in the fragmented tracking of data, especially when we deal with high-risk patients, when they transition between complex inpatient care, highly specialized outpatient clinics, and also home self-care management.
Thanks a lot, Mina, for mentioning the central nervous system and how there's a huge shift that we're noticing in how AI is being adopted in healthcare settings, where instead of using health tech or health technology just for documentation after things have happened, now we're starting to use it as a preventive measure where we're able to analyze all the data beforehand and start creating predictive models and preventive models around that. So thanks a lot, Mina, for sharing that. Would you like to elaborate on that with an example?
Yeah, sure, Andrew. So actually, as you know, I'm a clinician with a pharmacy orientation and a pharmacy background. So let's take an example for advanced oncology pharmacy practice as a primary example for that shift. So today, the landscape in metastatic cancer stage 4 management is shifting rapidly towards targeted tumor-specific precision medicine. So actually, for many years, systemic therapies were used and were used without fully account to the molecular heterogeneity of the disease. So in some patients, previously unrecognized genomic alteration may contribute to the treatment resistance and disease progression over time despite standard approved therapy. So back to this. So disease progression, actually, this is what actually happens on the clinical background.
Mm-hmm.
So disease progression can occur from metastatic castration, or we can call it castration sensitive or hormone sensitive, which the patients usually responses well for the hormonal anti-hormonal treatment for the prostate cancer, and it can progress to something called metastatic castration resistant or hormone resistant prostate cancer, which is actually a more aggressive disease state associated with poor prognosis and also reduced responsiveness to hormonal therapies, as I mentioned. So imagine if we have a predictive integrated AI system. It can analyze the next generation sequencing or what we call NGS data alongside with the family history risk factors. So we can flag patients early to detect the germline or somatic BRCA1 or BRCA1 gene mutation, which means these gene mutation can be inherited or only and it just came out from the tumor cells itself, not the whole body cells, just to make it simplified. So we, by accurately predicting which patient harbor these gene mutations and specific homologous recombinant repair deficiencies, the AI can help the clinical team to immediately shift earlier to more precise targeted therapies. We have something called specialized BARB inhibitors, and actually sometimes a combination of regimens, including this type of treatment, and this is recently approved for such patients. So this actually, if you look at it from the clinical perspective, this optimizes the survival outcomes and actually spares the eligible patients for such treatment from the toxicity of unnecessary treatments before the disease progress, if you call it bluntly, because we don't know exactly the exact gene mutation which we need to target for more precision medicine.
Right, right. So, thanks a lot, Mina, for sharing that. It's quite exciting to hear these kind of clinical use cases. We are obviously on the more of the admin side, but this is where the real work is happening. I
Exactly.
had the opportunity to speak with another professional who's working with NHS to help with skin cancer detection. So, being able to create solutions that are actually detecting cancer and in a preventive manner, because obviously the earlier you're able to diagnose, the better chances you have of curing it, and that leads to enormously positive outcomes. So this is great to hear about these kind of real cases, and thanks a lot, Mina, for sharing that
That's
with us
no
today.
problem. Thanks so much. Appreciate your perspective, Indra.
And moving on, we also want to understand, how do you see the healthcare industry? Obviously, this is a huge change, and healthcare has always been known to be, and for very good reason, a slower industry in terms of adopting technologies. So, how do you see the healthcare industry adopting this change? What kind of pushback and friction is faced while introducing these kind of innovations to healthcare providers? And how can tech companies partner with clinical leaders to manage this change resistance effectively and design solutions that are more in line with clinical workflows and core systems at health institutions and larger health systems?
Thank you, Andrew, for this question. So actually, the honest answer for this is the technology stage is often ready, but the human stage is not. So actually, as you beautifully mentioned, Andrew, We have to set the floor to adapt that change. So only then technology can run smoothly on a highway. If a foundation isn't ready, the tech will crash, as you know. So clinician resistance, as I can see, rarely comes or stems from a dislike of technology. Nobody hates technology for technology itself. It's actually coming from the administrative fatigue. So clinicians actually hate the tools which add clicks to their day and operations every day. They hate the tools which dictate their clinical judgment. So this brings us to the most critical and least discussed, if you can say, and also yet evolving trend in digital healthcare today, which is actually the prompt engineering led by clinicians. So from my perspective, I can see that for AI to succeed, we must build a paradigm of a clinician guided AI, not AI guided clinician. We don't have software engineers working in a vacuum, writing prompts to dictate the clinical decision support systems for the clinicians in a healthcare system. So if AI blindly prompts a doctor or a pharmacist based purely on a generic language models, which is actually currently there. So it creates an alert fatigue. So whenever you have an alert from the system, you actually clinically you don't believe that alert. So it will create an alert fatigue, and also sometimes it covers the clinical blind spots for each case. So instead, the clinician must be the one driving the prompt engineering. So if you imagine if a clinician is structuring the clinical context and he's the only one weighing the critical patient clinical parameters. So and embedding exact the safety guardrails in the AI logic. In that situation, in that case, we will have the AI safe to use and valid, and the clinician will stop resisting AI to take place and help them. So when clinicians lead the prompt engineering, as I mentioned now, the AI stops acting as an external inspector trying to guide the expert. So it becomes an augmented extension of the clinician's own intellect, building directly into the workflow. So that's how you eliminate the friction, and that's how you pave a highway for the clinician to actually want to embrace the technology of AI in healthcare.
Right. That's a very interesting perspective. And I remember last time also when we met, you were telling me a story about how your experience with prompting and how controlling the input vastly changes the output. And
Exactly.
somebody with medical intelligence who understands what needs to be prompted, and once they are able to, once it's not a black box for them anymore, right? Once they understand how it functions and what do I need to tell it so that I get the right kind of structured output which can actually speed up my work, get me better results, accuracy. So very, very interesting to hear those thoughts. Thanks a lot.
Thank you, Andrew, so much. So actually, from that point, when we discussed the clinician-guided AI, this is exactly what I admire about the great work that what you are doing at the Dezy IT. I have seen actually Jessica in action, and I have seen the AI agent you have built, your Diva 360 platform. And actually, I can say the work you have done is very remarkable. And I cannot imagine that Jessica is just an AI agent. I feel that she's a human. She speaks actually and asks question to patient. I'm a pharmacist, and I can see how she takes the patient information, how she takes the medical condition, if any allergy for the patient, and how she asks question related to the medication history if the patient is taking another medicine. So it can record and put and document in the patient profile in the system. I can see how it integrates seamlessly to the EHR systems to automate appointments, uncover strategic leads, and also to improve the business growth. So actually, from a builder perspective, Andrew, how you maintain Jessica as an AI powerhouse, firmly anchored to the clinician guided parameters, adapting to the expert rather than the clinical workflow to adapt to the machine.
Right. So, I think one of the things is that we have started with mid-segment clinic chains. So there we're talking directly to their top management, and they already have a certain protocols and processes in place on how they want calls to be handled. So it becomes much easier for us to replicate that same kind of guardrails and guidelines. And unlike the kind of AI that we were talking about earlier, where the clinician is prompting it, here the clinician is setting it in the beginning and making sure it's optimized, and then they just let it be. They're not monitoring it on a day-to-day basis. It's just doing its job. It's like the AI scribing is again another powerful health administrative tool that is becoming more and more popular. And all of these tools are such that if done right, if done with the clinician and with the administrative team and set up properly, then after that it becomes more of something that is running on an autopilot and saving the clinical administrative team hours every week. So that's how we see the advantage of this whole system.
That's amazing.
And
That's why I can see the great work you're doing there. So actually, I know that you are a seasoned tech innovator, Andrew. So, and you have worked globally across multiple healthcare landscapes from India to USA to also Australia, right? Am I right?
yeah,
So,
right.
how do you ensure that Jessica handles this clean feed and high quality data back into the primary workflow? How do you make the data points precise? And we need to engineer accurate and save clinical prompts for Jessica to interact with patients.
So this was actually one of the toughest things, especially as a techie, because as a techie coming from a design background, because from a design perspective, our first inhibition is to jump in and test. The moment we have something even scarcely ready, we want to go and test it with actual people to get real result and real feedback. But in this case, because it's patients on the other side and it is a clinical setting, it's a healthcare setting, even if it's a dermatology office, the patients care. You can't afford to have a bad conversation. So
Right,
we do work closely with the clinical teams. Every geography has its own nuances in terms of compliances, dialects, pronunciations. So each and every instance has to be very carefully designed and tailored for the specific setting, and then tested rigorously before we are able to roll it out. And even when we roll it out in a very contained manner. So we would first day we may run it for only 1 hour, and there'll be 15-20 calls. I'll come in, we'll test, we'll actually see, make sure everything is fine. Then we'll push it for 2 hours, 3 hours, and slowly we will ramp up the deployment to make sure that there are no hiccups, and especially no hiccups at a scale. You don't want to be sitting on a large scale
right.
problem. So that's how
It's a
we
difficult process. I can
contain.
feel that.
Yes, yes, absolutely. So, I mean, thanks a lot, Mina, for highlighting that and mentioning about your experience with Diva and Dezy. I'd like to talk a little bit about the future and how you see this future being reimagined in the next 5 to 10 years. Obviously, AI is evolving at such a fast pace, technology, healthcare, everything is evolving at such a fast pace. So, what do you see from your perspective? Uh, how will things change in the next 5 to 10 years?
Yeah, Andrew, actually, I think the future arrives faster than we expect, and in ways that I feel clearly not seen by many. So let me tell you what I see. In 5 to 10 years from now, so or maybe far less, I see the future as built not only by coders, but by clinicians hand in hand with coders, where technology handles the heavy data tracking seamlessly according to our clinical instructions, leaving the human clinical teams, which is us, free to provide deep and empathetic, perfectly timed interventions with real patients to do the human work. So maybe what we have mapped out today on a spreadsheet is not visible today as we speak for a lot of people, as I mentioned, But sometimes when we try to see what is not there, or seeing the unseeable, if I prefer to see it in this expression, um, this gives us a room for innovation. This drives the meaningful change in healthcare. So this is how I see the future.
Very, very interesting, and I definitely see it going there because a lot of our Anthropic, OpenAI, all of these, they're trying to focus on how to make building technology, managing technology more and more easier, so that what you actually need is the business intelligence, the operational intelligence, and that is something that clinical healthcare leaders bring to the table. So uh, great to hear your thoughts, and thanks a lot, Mina, for taking out the time from your busy schedule to record this episode with us.
Thank you, Andrew, so much. This has been one of the most energizing episodes I have recorded on the subject, and I hope it sparks something for everyone listening. Thanks so much again for having me.
Absolutely. Thank you.
Thank you.